I'm Charles Haley, and I'm an infectious disease internist, and I'm currently working with Noridian Healthcare Solutions. We're one of 8 claims-paying Medicare contractors. Each of those 8 claims-paying contractors processes about 500,000 Medicare claims every day to the tune of about $100,000 a minute. Noridian has the Medicare contracts for 13 western states, basically everything from Arizona to North Dakota and everything west. People have recognized for a number of decades that the fee-for-service model of paying for healthcare services is probably not a sustainable model. And so there have been all kinds of attempts over the last 30 years to introduce some incentives to provide a payment system that doesn't have perverse incentives to supply too many services and too many unnecessary services. One of the changes that was in the Affordable Care Act was that in the Affordable Care Act there were 24 quote alternative payment models that were defined in the Act. That people could use when organizing themselves in a local organization to bill Medicare. Well, not a whole lot of people were interested in those alternative payment models. Well, then this last December, there was a new bill, MACRA, which most physicians are aware got rid of the sustainable growth rate factor. But MACRA had a lot of other things. It provides direct incentives to participate in these alternative payment models that were defined in the Affordable Care Act. Furthermore, CMS has set the goal that by the end of this year, 2016, over 30% of payments of Medicare will be made through these alternative payment models, which is a major sea change in how things are being paid. What Congress said in MACRA was that they want to pay for efficient, high-quality care. And so the alternative payment models provide the efficiency side of it. The high-quality care is another aspect. Right now, there are incentives for electronic medical records, there are incentives for quality services, and there are some incentives in certain circumstances for resource use. But those are separate programs right now. What will happen under MACRA in the near future is those 3 programs will be all combined into one, and every doctor or every accountable care organization will get a single score that encompasses their use of the electronic medical record, their use of ongoing quality improvement activities, of some measurement of the quality of care that the patients have received. All of those will be combined into a single annual number that can adjust your payments on an annual basis up to a maximum of 9% more or to a minimum of 9% less. So it's going to be important to, as all of this is rolled out over the next couple of years, is to pay attention and understand what the changes are as they are rolled out. All of these western states that we work in, that Noridian works in, there are large spaces with not a lot of people and not a lot of doctors, and so it's going to be real interesting how this folds out. As I said, the MACRA was only passed in December. The regulations were just drafted and published in April. It means that you probably need to be in a larger organization, not necessarily not in private practice, but you need to be you need to ally yourself with a larger organization of other doctors and hospitals to better organize care and better coordinate care. Do you have to do it? Nope, you don't have to. 70%, we're not expecting this year 70% of the payments to be made. I mean, we're only expecting 30% in the alternative payment models. But they're expecting that to rise dramatically over the next 2 or 3 years. Oh, you have plenty of time. But you do need to be watching the various journals, watching the things that come out from the Medical Society, because everybody's going to be watching this over the next few years to see how this unfolds.